welcome to Sober Dad Crew, the podcast where we talk about all things dad, sobriety, recovery, parenting, music, tattoos, and more. For more information or to get in touch, visit soberdadcrew.com. My guest this episode is Angela Sullivan, Executive Director of the Alcohol and Drug Council of Tompkins County, which we might refer to in the interview as ADC. And in full disclosure, I am the Vice President of the organization's Board of Directors. Alcohol and Drug Council believes that addiction is a treatable disease that is biological, psychological, social, and spiritual. In addition, the organization is about to open a 24-hour open access and detox center that will provide life-saving treatments and services. Angela, welcome to Sober Dad Crew.
Thank you so much for having me, Stephen. I'm really excited to talk with you about this.
This is cool. We've been trying to do this for a while, and you are doing so much talking about the aforementioned open detox that sometimes your voice is very tired.
Yes, we're recording this in the evening, and a lot of my voice has gone for the day, but we're doing, 3 to 4 tours a day with different community organizations. Between that and phone calls and trying to get the bigwigs to come to the ribbon cutting, I do a lot of talking.
I was trying to remember where we first connected, and I think it was when I was at the credit union, and we had a meeting, and I brought up being sober. And I don't know if you know this, but that was sort of my first super public outing of that. I always kind of just was sober and kept it. I just didn't make a big deal about it, but I didn't publicize it. And I kind of had that moment with you. I was like, well, if I can't say it to these folks, like, who can I see it? And that was some of the origin of Sober Dad Crew. So thank you for that meeting.
Thank you for disclosing that in that initial meeting. I know you and I have talked in the past how there's the whole anonymous part of being sober, and that has its place. And in some ways it hurts, we'll call it the field, the sector, because there are lots of sober dads out there and sober moms and sober brothers and sober sisters and whatever.
Yeah, and sober coworkers.
About it. Yeah, exactly. And they just don't talk about it. And I can say it definitely impacts funding. When you talk about all of the agencies statewide, developmental disabilities, mental health, all of those, the ones that support people with substance use disorders gets the least amount of funding. And I think that's because the numbers are not out there, right? Like, people are not as visible. And I get it. The stigma is real. It can impact people's perception. And so I get it, but it is always, I feel just very appreciative and grateful when someone discloses.
Well, I think the face of it also, right, there's so much misunderstanding and stereotype, right? They don't sort of expect the person who's director of marketing and development at an architecture firm, or they don't expect my buddy Sam who owns the clothing store. That's not what people think about. But it really is the reality, is that there's more folks, I would argue, like us than the opposite.
It is. And it is, an individual's choice and their story to tell. And so, again, this is why I'm really grateful. I know I saw your post on LinkedIn. And it was like, ooh, we should talk to him about board service.
Yeah. And, you've been, 12 years at ADC?
12 years, yes.
Yeah. So what drew you to this field?
So I've always been a nonprofit professional. I sort of alternated between higher ed and nonprofit work in my career. I started out in Buffalo and helped to set up Hearts for the Homeless. That's a whole nother story, but that was really my first gig in the nonprofit sector. And they were kind enough to actually pay for me to go take a nonprofit management course. And then I just really found that this was my vocation. I can tell you that in the work with Hearts for the Homeless, a lot of what we saw were disenfranchised people who were using substances, alcohol and substances. And then I got married, I moved to Colorado, and I started working in nonprofits there. And I worked, working with youth empowerment programs and domestic violence prevention services or support services. And then I moved back to New York, worked at Community Action, addressing issues of income inequality and, again, sort of like those, what they call the ACEs, the adverse childhood experiences. And I decided then at that job that although it was rewarding to do one by one by one, person by person by person, I wanted to have policy impact. And so I went back to grad school and ended up working in DC for a while. And I wanted to come back to New York, and I wanted to do something that was sort of a through line of my career. And when I saw this job post for Ithaca, I loved Ithaca. I came here kayaking and hiking and all of that. I used to live over in Madison County, New York, and it was just a great opportunity. And for something in my head clicked that this was that through line where I could use diverse, different sort of interests and parts of community development and collaboration to actually have an impact on how people were treated.
And all those other areas you worked in also intersect with substance use. So much of this really, really is tied together. Most people don't set out to have substance use disorder. It's not like
Right.
not most people's life goal.
Nope, it's not. And it's often either blamed for those other issues or an excuse for those other things. And as a student, right, you learn this whole, it's not causal, but it's definitely correlated and cyclical and generational. And anyway, so that's why I took this job.
Yeah.
Is to try and have an impact.
Let's talk about the Open Access and Detox Center. Can you just give an overview? I know you can. Definitely give an overview of what services the center will provide. But a lot of people listen, they're not even from, the Ithaca area.
Right. It's a unique model in that there'll be 3 levels of care co-located that are sort of the beginning or the front door of the recovery continuum. And they're each significant in their own way, but put together, I really feel they're like this just amazing portal to great things in the community. First is the Open Access Center, which is essentially an outpatient clinic, but it is 24/7, 365 days a year. So someone can walk in the door and they can get information, they get a Narcan kit, they could get fentanyl test strips, and they could go. Or maybe they want some form of treatment. So they could come in and get medication-assisted treatment right on the spot. They can get assessed to see if they have a substance use diagnosis and then be referred to whatever that diagnosis leads to. So it could be to one of our 40 beds that make up the detox and stabilization part of the other 2 levels of care. Or it might be that they want harm reduction, or they just are looking for something we don't have. Maybe they want connection to sober supports and they don't want to go into a program or whatever. So our job is to actually make those connections person to person, not just a business card or a brochure or a number scribbled on a piece of paper. Our job at the Open Access Center is to actually make that human connection between the person who walks in our door and says, finally, I want help, right? I've had enough. I want to do something differently. And the correct service that they want. It's all very patient-centered. And so we have to make those connections. If what they want and what they're diagnosed with qualifies them, and then again, that's less than 24 hours. So that's sort of like a walk-in outpatient service. If the person wants and is diagnosed with needing detox, they can go right upstairs and do one of those beds. Our detox is what's called medically supervised withdrawal. So it's a step below hospital-based detox. So, for example, we can do IVs, or if people have seizure disorder or some of these things that go, especially with alcohol abuse, they really their first step should still be a hospital. That detox stay is generally 3 to 5 days-ish, depending on the person. And then, again, our job is to connect that individual with whatever the next service is. Many people are going to not be ready for a next service outside of our facility. And so what they would do is then just sort of in computer world transfer over to what's called stabilization. And stabilization is where they can work more on vocational skills, get more counseling, more other supports. And it's a safe place where they can wait until the next thing is available also. So say what they want is a really specific recovery program tailored to their needs. Say it's a women with children program, right? So we can't do women and children. Then they can actually stay in stabilization, 2 to 3 weeks, as long as 45 days, so that again, we're not just discharging someone to a sidewalk. We're making a connection person to person. So the whole piece of this is this idea that it's what's needed is a community response to addiction, substance use. And so by bringing in community partners to do vocational work or bringing them in to do physical health work, like work out in our wellness gym, that kind of thing, they're making a connection in the community that's a healthy connection, as opposed to, again, just a appointment card. So I could probably talk about this for 4 hours straight.
I know you could. I mean, and there's a couple of things to sort of circle back to. I think one is the notion of connecting them directly with services, because avoiding the gap, right?
Yeah.
That the gaps are where people fall back, be that into a 12-step program or into some other therapeutic setting, whatever it is. If there's a gap created, especially when someone is just white knuckling it still, it's probably not going to work out. So that's incredible. And I think, I've toured the building a lot, and every time I get emotional because it's incredible and such cool stuff is going to happen there. But you're also doing other things that are pretty unique. I mean, it's really gender affirming. So can you sort of talk about that and the process? Because that's what ADC is doing, is going to be the exception to the rule.
It's 20 beds, essentially. 40 beds, 20 male, 20 female. Like that's the base application put in towards the state to get this thing going. But we really talked a lot about sort of the diversity along the spectrum in gender, and the fact that we'll have transgender folks and non-binary folks who are all coming in and should have a comfortable, safe environment. And so coming from the lens of what's called trauma-informed care, right? So you want to have as little or as few triggers, if you will, for people, barriers for them to access treatment. We actually have on the male unit, and we work really hard on our language, and we slip up sometimes and call it the men's unit. But in the male unit, person could have been born female but identify as male. They potentially would have a single room in the male side, and vice versa. We're really working to put people the gender that they identify with, not gender at birth. And we actually have there are tons of locking and unlocking doors. It's basically a big rectangle, but the way the hallways and everything and bathrooms are laid out, we can actually flex beds, male, female, and we can actually sort of make a little unit all on its own that could be gender non-binary, because it's a room with its own bathroom, so that if they are uncomfortable or have trauma related to that, they could be in that particular unit that has 2 rooms and a bathroom that they can actually fit into that. Did that answer the question enough?
It did, but you had to put a waiver in, right, to New York State, right? So this wasn't like New York saying, oh yeah, this is how it's done. This is you all saying, no, this is how it should be done.
This is how we're going to do it.
You've told some stories about all the tours you did, and a lot of what you learned is we're not doing it this way.
No, we're not. Definitely not this way.
I mean, these beds are going to have, handmade quilts on them, really little things, but huge things.
And that's part of that community piece. I would even go back a step, Stephen, and talk about before we had a building, before we had a plan, before we had anything other than the realization that we need a service that people can access 24/7 and that we need beds. for people to detox in because we didn't have them. And the closest thing was like an hour and 20 minutes away. And that's too far. I mean, if the mood hits you at 2 a.m., you need to go somewhere, you know? And so what we did is we talked to lots of community and regional organizations and asked them these 3 questions. Like, what are you seeing on the ground? Like, what are you experiencing? How does this issue, substance use issue and addiction, how does it impact your work? And then what do you need? Like, if we could build something, what would you need? And then the third and important question for us at least was, okay, how do you want to help? Like, how once we do this thing, how are you going to fit into it and how can we help? And so that's sort of where this idea came in, where we have designated spaces for community partners to work within the building. So again, if it's only Alcohol and Drug Council staff coming in and out of the building every day, we'll have missed the whole mission vision of this thing. The whole idea is that it's the individual who comes in for help, whatever that help is, you know, treatment, I'll say in the broader scheme, that they understand that there is a community of organizations and individuals who are on team, we'll say Angela, right? They're on team whomever, team X. That makes a huge difference. Think about anything in life and how much better it feels if you know you're not in it by yourself.
Yeah, I want to circle back a little bit to harm reduction too, because I think there's a lot of misunderstanding about, what that means. I mean, I really operate on the theory that dead people don't get better and that there's a lot of roads and paths to recovery. Can you sort of talk a little bit broadly about the philosophy of harm reduction and then maybe how ADC is going to apply it?
Yeah. So harm reduction, like you said, operates from this perspective of, if you put up too many barriers and things people have to achieve before they can access the care that they are entitled to, they're not going to get there. And unfortunately, sadly, they're not going to get anywhere. They're going to die. And so this harm reduction model, it sort of runs through everything in prevention, treatment, its own component of harm reduction and recovery support. It's this idea that addiction is a chronic recurring disease where relapse is a function or a symptom of the disease. It's funny because this project has taken so long that even the state has shifted again to harm reduction. But when we were talking about it 5 years ago, when we started this, it was not something people were talking about very much. And so, for example, we were one of the first treatment agencies in the upstate New York region to have Narcan trainings and Narcan kits for people, doing opioid overdose reversal. How things work within Alcohol and Drug Council is it is very patient-centered, and gone sort of are the days of 100% abstinence, unless that's the person's immediate goal, because it, like you were talking about, white knuckling it, that makes me cringe every time I hear about that. There's so many ways for people to not do that and still not go cold turkey and all those things, right? So there's a lot of medication that can reduce withdrawal symptoms. So that's part of harm reduction, right? We're not telling people go sit in a jail cell and detox on your own, right? We're saying, no, come here to this. And there are things, I'm not a doctor, so I won't say what those things are because I don't honestly know them all, and I don't want to make a mistake. But the intent is that you meet people where they're at, and that change is incremental, right? And so there are lots of strategies related to harm reduction. So a classic one that we talk about a lot now at ADC, because it still feels a little funky, is this idea that people can come in to want to quit opioids, but not cannabis. Right. And so then we have to have all these policies and procedures about how do you do that. And it helps a little now that it's legal, but it also makes our job a little bit harder, quite honestly. But again, and the detox, I think everybody has in their mind this idea of what detox is, especially the public who's a little more removed from this. That is not what we're doing. We're not like strapping people to a bed and plugging them in with an IV and all that. I mean, it is compassionate, patient-centered healthcare. And so anything we can do to meet people where they're at and sort of get them to whatever their next step is, that's our framework for harm reduction. And again, we'll have on the far extreme of harm reduction is we'll have a vending machine in the entryway, in the vestibule, where people can get Narcan kits and fentanyl test strips. So they don't even have to talk to anybody. They can just
Right.
come into the lobby and get Narcan and fentanyl test strips and go. So
Yeah, because that will save lives.
It will absolutely save. Yeah.
And I think show that come the time when they want to get higher levels of care or have somebody else, they might be getting that because of a family member, right? It might not, not even be for them or a friend or that kind of thing.
Yep.
I think that's incredible. I think one other challenge, I'm seeing, and I guess it's always been this way around drugs. It's become politicized. Maybe it always has, because if you look back to the days of crack versus, cocaine in the 80s and the drug sentences around that and how much disparity there were around race, I guess it's always been there. And sort of this influx of fentanyl is really firing up the politics again. But now, so the argument is about securing the southern border, right? It's not about actually addressing the root causes behind addiction, right? That, of poverty and racism and all these things. We're like, no, we got to secure the southern border. And, for sure, if you've read like The Least of Us by Sam Quinones, which is an incredible book and literally lays out the history of fentanyl coming to this country and how it went from Las Vegas. I'm kind of a wild story in that book. It's like this drug addicted, dealer in Las Vegas is talking to this other guy who says, "Oh, my uncle in somewhere in the Midwest." And that was like first sort of fentanyl pipeline. And then it just took off and it's easy to manufacture, but we're not actually talking about what lies behind these things. It's just this political battle, which I guess is just the world we live in right now. Frankly, is just sort of polarized, but
yeah. I say something which is like a really bad metaphor, but it's the only one that works for me, or like phrase, is that we're always trying to cut off the source of drugs instead of getting at the root of the problem. Like there's mixed metaphor there. But
right.
I mean, the reality is what it would require to get rid of the need for people to use substances, or desire for people to use substances, is getting at the root of societal inequity and racism and all those other things that take a ton of work, and they are nuanced and like can be emotionally draining. Like it's hard work to do community work and to go into a community that you have wronged and say, hey, let's try and do a reconciliation session or something. Like I'm very much, my education background is in international relations. And I just think of all we sort of need a bunch of reconciliation commissions in this country. Like we're going overseas and doing it everywhere else and facilitating it in Africa or whatever.
Yeah, I mean, and South Africa was incredible. What Desmond Tutu did was remarkable. But, America in its history, not so good at that, not really wanting to address those things. No. And, you think the capitalists would understand supply and demand, right?
Yeah, but they see
it is as kind of a basic equation. Yeah.
They see it as a capitalist, which is the thing, right? Like, so they think that they can get at the demand by just cutting off the supply, and it's not going to work because they're just going to switch to a new substance. They're going to go from, Captain Crunch to Fruity Pebbles or something. They're just going to get what's there. And honestly, if they're going to grow it themselves.
Well, and the leftist in me also understands the prison economy. Yeah. And actually, America functions well by having people in prison and poor people. I mean, that's how we have fabulously wealthy people. So I guess I'm sort of like a communist swimming in through my life through capitalism, but there are benefits to the larger system. I mean, if you just look at, alcohol, sort of the biggest legal drug that's out there, and how much influence the alcohol industry has, it's just incredible. And all the marketing, it's like, if you're the dad, you're supposed to drink during the game. If you're mom, it's wine o'clock. I mean, there is so much marketing out there that it's really kind of shocking, but no one's really looking to address that.
No, I mean, this could be a long and deep political conversation, and you and I are fairly aligned in our perspective.
Yes.
I feel like, nobody learned anything from tobacco. Like
Right.
we know they target kids. We know that it's not good for you. We know, like, all the things that are true about tobacco are true in some respect in any of these types of substances. They have huge lobbies and they have buku bucks, and even things like the cannabis industry. Like, there was no stopping or help or like guiding where dispensaries go, right? Because little nonprofits and little small town governments don't really have a say. And
Right.
if you look, at other states, a lot of them where they put the dispensaries was right where they made them take away alcohol signage at child height and took away density of liquor outlets and all of that. But yep, they put a cannabis dispensary right in that community.
And in
Like,
reality, how that industry, I think, will develop, it's also going to be the big players. It'll be the Anheuser-Busch's, maybe literally Anheuser-Busch, but it'll be all these huge companies producing that. So,
yeah,
and
yeah,
not, I mean, I think there's some states, I think New York's a little different with trying to address who's getting the licenses for those things. And, that's definitely a whole another lane and road and conversation. But yeah, there's just a lot of justice issues around all of that.
yeah. Like I said, we need a bunch of reconciliation commissions, and we need a bunch of restitution. We need to restore people. This has been sort of my life's work, is to look for the people who are unseen, or like we don't want to see them, we turn away, and see if there isn't something that, from a policy standpoint, can be done to change that.
I think that ties back to sort of being out loud in recovery. We've said it before. A lot of what people see if they're driving around any city, or not even city, rural town. I mean, fentanyl is really like torn up everywhere, but what they see, like I said, was not the reality, which is one motivator for me to say, look, this is everywhere. And it's easy to other people because also America's super strong at othering people.
Well, I was just going to say, there's this thing or this model in prevention that we use a lot with children, teenagers, is this idea of social norming. Because again, they have the perception that everyone is doing it, right? Like that, I can't even tell you how many times I said that as a teenager, right? But I want to wear this. Everyone's wearing it, right? But the reality is, it's not true, especially among youth, when you talk about how many people are binge drinking or smoking pot or using pills or whatever. The majority aren't, right? But nobody puts that message out there. They put out it from a negative thing. So if you can social norm too around being in recovery, and that there are more of more people in recovery than you would ever know. Lots and lots of people, I think. Again, that sort of shifts policy. A few years back, they had in DC, I can't remember what they called it, but it was part of what made us think of doing Recovery Rocks. Was they had a big concert. I mean, it was like all big music acts who are individuals in recovery, because they were talking about decreasing funding. And this wasn't that long ago. This was like maybe 2014, something like that they were talking about decreasing funding because this wasn't a problem. Right. There was no
problems here. Nothing to see here.
Nothing to see here. Let's just give more tax benefits to whichever. I won't use names. I'm usually pretty careful about picking corporate names. They have Google searches or whatever.
Yeah. Don't sue Sober Dad Crew.
Yes, please.
Just little old me, just doing my thing, skating on the left. It's interesting in the workplace too. And one other reason I'm, pretty not vocal at work, but I don't hide it and I talk about it, is I see the younger staff that's coming in, especially, I mean, I guess really in the workplace, it's about alcohol. Like most workplaces don't really have like a lot of other substances going on. But, that notion of like, let's all go out for drinks after work, like the younger kind of generation, those people we're hiring in their mid-20s, they do seem less interested in drinking. And certainly it ties into their broader sort of view of the workplace. But that's, one place at work, and I was like, well, let's make sure there's just seltzers, So on Friday, if we decide to kind of like do a little gathering, let's really make sure it doesn't feel exclusionary. Because like for me, I just don't struggle with it,
Mm.
but that's not true for everybody.
Yeah.
And so you might put that out there, and that could just be a
Yeah.
lot. And really, to my mind, do you really need to have beer at work?
No.
Aren't we just sort of letting off steam and just trying to socialize after a long week? Does it have to involve alcohol? And I do feel like that younger generation is sort of less interested in that component. And we got to create open spaces, right? In Tompkins County, we actually have on the job training grants for people in recovery, which I think is pretty incredible. I think, it's morphed over time on how to best get those used, because not everyone's going to sit there in their job interview because they want the job and be like, oh, by the way, can I have I have a substance use disorder I'm recovering from. Can I have that grant? Like, that's not maybe the way it's going to reasonably happen.
Yeah, it's how some of that works is we know particular employers hire people in recovery. And so when they say, hey, I've got a person applying for a job, we
Yeah.
sort of take it as, and they're not huge amounts of money either. So,
Yeah.
I mean, for $1,000 to get somebody a job, it's like, or whatever it is, I think it's 4,000 now actually, but when they started, it was less. I think there are definitely ways of acknowledging, so I mean, I'll go out there. I'm not a person in recovery, even with, I'll do a slam at my own heritage, even with the name of Sullivan. Alcohol and drugs has not been my issue.
Yeah.
So I'm grateful for that. I grew up in a family where there was very little alcohol. It was just not a thing. In fact, I have a vague memory of my parents in the 70s, dating myself, my mom dumping out Chianti wine so she could have the decorative,
Is it the Carlo
wine.
Rossi?
Yes, with the little candle melting down the side.
Yeah, because my parents got that
thing.
like Carlo Rossi. I don't
Yeah.
even know. You could probably clean with that.
Yeah, I don't know. I just remember her dumping it down the sink so she could use them as candle holders because it was the 70s and she was having a party. And so she
Right.
wanted to be cool. So what I was going to talk about was this idea that I've found, and I welcome people to join me in this. I'm that person at events who first thing I do when I walk in, I'm like, okay, what are the non-alcoholic beverages? And where are those? And, like I've had some success. We've moved some sort of community business events to places that don't serve alcohol. So like there was a chamber after hours at a gym or things like that, instead of always being at a place that serves alcohol, and always sort of pushing back against this. If you're giving wine for free at an event, why do I have to pay for a soda? Like, why do I have to pay for juice? And some events are still like that. And so that's sort of the thing I go with, because again, like I know people struggle with it, and I don't want to not have an important person at an event because are too triggered by, or too newly in recovery or too whatever. Right. So yeah, we need to take the focus off of alcohol.
Yeah. And it can be hard enough to find venues. I've been trying to find a venue to just do like a monthly, just sober kind of meetup, happy hour type thing. And it's so hard to find a place that isn't economically dependent on serving alcohol to make money. Were we in a bigger community, like I interviewed at one point the owner of Sands Bar in Austin, like that's a big enough city to support that. And maybe it would work in Ithaca if somebody had sort of the willpower to do it, but you do need a certain population that will support an institution such as that, and probably still sort of emerging from COVID when people are going out in different ways. It might be a challenge.
There has to be moderation, or like some middle ground here. I think we've swung way too far towards the focus on alcohol in particular. It can definitely be hard to find a venue. I know my stepson and daughter-in-law live in Brooklyn, and there are tons of sober cafes in Brooklyn. They're lovely places, great food, live music, all that sort of thing, and just not driven by alcohol.
Right. And community, right? Which is probably the theme behind all of this is people need community. They need contact. It is hard to recover from anything, any substance use disorder, any trauma, anything like that. You cannot really recover in isolation and silence.
Well said. The antidote to addiction is connection, is sort of my little phrase taken from research and probably screwed up the quote from somebody else. But the whole point is, and especially coming out of COVID, there are a lot of people self-medicating during COVID. We need to get back and learn how to connect and to do it in a more healthy way.
And I think that is an awesome place to end. Thank you very much.
Thank you so much, Stephen. And if there's anything you can put over it about encouraging people to go get help now. Like, I feel like, don't wait. Like, it's dangerous out there.
Thanks for listening. For more information, for links to any music or books we talked about, or to buy some Sober Dad Crew merchandise, please visit SoberDadCrew.com.